Thank you, Mr. President. I rise today to support the health care reform legislation that's before us. And I want to talk a little bit specifically about what the bill does to reform our health care delivery system. And that's really health care jargon for the way we provide health care to people who need it. I've heard a lot of debate earlier this afternoon about the fact that the health care bill doesn't do anything to address costs. Well, I think that's just wrong, Mr. President. The fact is, this health care bill does begin to address costs in our system. That's one of the reasons we've got to pass it. In fact, we know that over the next 10 years, it's going to reduce our deficit by $130 billion. But more importantly than that, I think, are the changes that I believe this is going to begin to make in how we provide health care for the people of this country. You know, the fact is, we all know it. Even our colleagues on the other side of the aisle know that our current health care system just is not working. It costs too much, and for too many families, quality health care is simply out of reach. One of the problems is that 30% of the $2.5 trillion that we spend right now, each year, on health care goes to unnecessary, inappropriate care and administrative functions that do little to improve our health. But, Mr. President, our health care system didn't get this way overnight. Years of perverse incentives have encouraged health care professionals to practice more medicine rather than better medicine. They struggle to see more patients and do more procedures to keep up. Hospitals race to build new wings and state-of-the-art units. As patients, we too often live unhealthy lifestyles, and we expect the newest high-tech services to fix it. In the meantime, we've undervalued things like primary care, preventive care, and mental health services. And despite all of our spending, we're not any healthier. Over the past few months, I've joined, as the President has, with all of our freshman colleagues on the floor to discuss why we can't continue this current system. It's too costly, it's too inefficient. And last week, the freshman senators introduced a package of amendments that emphasizes cost containment. The provisions contained in our package may not be those that are currently grabbing headlines, but I believe they really go to the crux of our reform efforts. They're the delivery system reforms that will improve quality and control costs over the long run. So, how are these going to work? Well, our delivery system reforms build upon the current underlying bill. They reward improvement in providing care for better health outcomes. One way we can be more efficient in delivering care is through what are called accountable care organizations, or ACOs. These ACOs allow medical providers to work in teams to take responsibility for decision-making, and they offer financial rewards for better health outcomes. Our amendments allow medical providers to align Medicare, Medicaid, and private sector strategies for improving care. Doing this will help ensure that all Americans receive high-quality care, no matter how they're insured. ACOs provide the right kind of incentives, and they promote value over volume. For years, the Dartmouth Institute of Health Policy and Clinical Practice has shown us that there are regional differences in the way care is delivered and how health care dollars are spent. Now, over the summer, Dr. Atul Gawande eloquently highlighted Dartmouth's findings in an article that he wrote for New Yorker magazine. Dr. Gawande clearly made the case that higher quantity does not necessarily translate into higher quality, so that more procedures doesn't necessarily mean better care. Now, Dr. Gwandi's article has had a tremendous influence on the healthcare debate. It's been quoted frequently by President Obama. It's been referenced right here on the floor of the Senate. In his latest article, which just came out recently, Dr. Gwandi has once again made an important contribution to the healthcare reform dialogue. In this article, he emphasizes the importance of delivery system reforms in fixing our healthcare system. And he points out that there is not one single answer. There is no silver bullet to what we need to do to change our healthcare system. And while we can all agree that something must be done, what we can agree on is what specific model or provision will be the best and have the most desirable outcomes. But Dr. Gwandi points out that our country has faced a similar challenge before. In the article, Dr. Gwandi draws a parallel between our current healthcare system, one that is very costly, a money drain, one that's fragmented, disorganized, and inconsistent. He compares our current healthcare system to the agricultural system at the start of the 20th century. At that time, more than 40% of a family's income went to paying for food. The inefficiency of farms meant lower crop yields, higher prices, limited choice, and uneven quality. Agriculture was on an unsustainable path. Gwandi points out that the federal government did not, however, offer a grand solution. Rather, it provided incentives to change the way farmers produce crops. And Mr. President, through innovation, the promotion of best practices, and smart dissemination, today food only accounts for about 8% of a family's income, compared to that 40% at the start of the last century. Now, as you know, and we've heard discussed on the floor, we have examples of great innovation and excellence in healthcare. Places like Dartmouth in my home state, the Mayo Clinic in Minnesota, which Senator Klobuchar can speak to, I know, Intermountain in Utah, and numerous other places of excellence around the country. These institutions have developed integrated healthcare systems that are patient-focused. Their practices have promoted high value and excellent outcomes, best practices which should be shared throughout the country. The Patient Protection and Affordable Choices Act identifies some of these best practices and provides the types of incentives for doctors, nurses, and patients to change the status quo and to experiment with innovation and excellence. The many programs supported in the bill before us move us in the direction of delivery system reform, which is so important to our effort. By promoting innovative practices like accountable care organizations, payment reform, and medical homes, we can move away from the current fee-for-service system that rewards volume over value. That, Mr. President, is true reform, and I urge my colleagues to support the bill. Thank you.